The coronavirus has killed 178,000 Americans and left millions jobless. And with uncertainty and much of life on pause, it can wear on your financial, psychological, physical, and emotional health. A new study found keywords like anxiety and panic attacks skyrocketed among Google searches in the spring. According to a CDC study, 25% of young adults have seriously considered suicide during the pandemic. That's even higher among unpaid caregivers and people with PTSD. Researchers also found in late June, 40% of adults say they struggled with mental health or substance abuse. Dr. Jessi Gold, a psychiatrist, tells me if you think you may be having a panic attack, focus on your breathing and try to ground yourself.
Initially, people were just really upended and worried about the uncertainty of everything. There's been so much uncertainty. Everything changes day to day. Uncertainty really preys on anxiety. So I don't know when I'm going back to school. I don't know when this is ending. I don't know what the rules are today. I don't know if I wear a mask or don't wear a mask. I don't know what I'm supposed to do or not supposed to do. And all of those changes really mess with us and make us just more and more worried and more anxious. And I've been hearing that a lot. I think the more that people have been home, the more that people have just been like, this is actually going to go on for a while, and this is actually what our life looks like for a while, the sadder people have become. I think that it's been hard for people to find ways to socialize and feel connected to people with the changes, especially people who might define themselves as more extroverted. I think it's been hard to feel those like human connections through the internet and through these like ways that we were socializing because we had to. And I think that's been pretty common with people. I think a lot of people have had trouble sleeping, and I think a lot of people have had trouble concentrating, and both of those have been really common. And I also think coping with things like alcohol or like turning to easy things that are just sort of there, which are not great coping mechanisms because they have dangers to them, have been really common with my patients as well.
Let's talk about healthy coping mechanisms then. What are some safe, socially distant activities that we can do to improve our well-being?
Yeah, I mean, one of the best things you can do is exercise. I mean, I think we forget that just simply going for a walk can do a lot for us, and we've been inside for a while. So going for a walk outside, you can wear a mask, you can walk with friends, you can make that into an activity that's social, and I think that can both help with the exercise component, which really helps your brain, it really helps your mood, and can help with the socializing component, which is really nice.
Dr. Jessi Gold, I appreciate your time once again. Thank you so much.
Of course, thank you for having me.
If you or someone you know is having suicidal